If you're a new parent, you know the advice on introducing solid foods can feel like a total minefield, right? Especially when it comes to allergies. One person tells you to wait, another says to start early. It's confusing and honestly, it's a little scary. But what if the science has finally given us a clear playbook? Well, that's what we're going to dive into. The incredible research that is completely rewriting the rules. To really get just how big of a deal this is, you have to see how much things have changed. I mean, for years, the official advice was to wait, to delay introducing things like peanuts. Then, in 2015, this absolute game changer of a study called the LEAP study came out. And now, today, the advice from all the major allergy organizations is the complete opposite. Get those foods in early. So the big question is, what on earth did they find that caused such a massive 180-degree reversal? Well, this whole shift happened because we got so much smarter about who is actually most likely to get a food allergy in the first place. It turns out it's not just random bad luck. The new science lets us pinpoint which babies are at the highest risk, and knowing that has completely changed the game for prevention. So get this, the single biggest risk factor we found isn't what most people think, like having an allergic parent. It's severe eczema. And we're not talking about just a little patch of dry skin here. The official definition is pretty specific. It's eczema that just keeps coming back and needs prescription-strength creams to manage. We now think that this broken-down skin barrier is like an open door, letting allergens from the environment get in and prime the body for an allergic reaction. Think of it like a risk pyramid. Down at the big, wide base, you've got most babies, the general population. Then you move up a level to kids with mild or moderate eczema, or maybe a family history of things like asthma. But right at the very top, that's the highest risk group. We're talking infants with that severe eczema we just mentioned, or a baby who already has a known egg allergy. Figuring out where your child might be on this pyramid is really the first step in this whole new approach. This brings us to a question that causes so much stress for families. If you already have a child with a really serious peanut allergy, what does that mean for your new baby? Are they pretty much guaranteed to have one too? And this is where the new thinking is just so important. The latest science shows there's no strong genetic link that says the younger sibling is at a significantly higher risk. The real risk is a practical one. Parents, and you can't blame them, are often terrified to bring peanuts into the house. So they end up delaying introduction for the new baby. And it's that delay, born out of fear, that actually increases the risk. Okay, so if delaying is the enemy, then when is the right time to go for it? This is where the new guidelines get super specific and give us a real actionable plan. First things first, there's a hard and fast bottom line. Do not, under any circumstances, introduce allergenic salads before 4 months old. A baby's immune system and their little digestive tract just aren't ready for it yet. Plus, you also want to see all those other signs that they're ready for solids. Like having good head control and actually being interested in what you're eating. So the magic window, the ideal time to start for all infants, no matter their risk level, is right around 6 months. This should happen right along with all the other first foods, like your typical fruit and veggie purees, as soon as your baby is showing you they're ready. So why is this timing so important? Well, just look at the results from that LEAP study. They are absolutely staggering. In the group of high-risk babies who avoided peanut until they were 5 years old, almost 14% of them developed an allergy. But in the group that ate peanut early and often, that number dropped to less than 2%. I mean, that is an incredible reduction in risk. It proved that eating the food early actually teaches the immune system to accept it. Now, when you see powerful numbers like that, it's totally natural for a parent to think, okay, wow, I want to do this, but wouldn't it be safer to get my baby tested first, just in case? It's a completely logical question to ask. Well, according to the research, the answer is a surprisingly clear no. Not only is routine screening not recommended, it would be wildly expensive. One analysis figured out that screening all high-risk babies before introducing peanut would cost society an extra $654 million. And it's not even as effective as the simpler strategy, just introducing it at home. That's why the new mantra is basically just feed them. So we've focused a ton on peanut and egg, and that's because they have the strongest evidence from clinical trials. But what about all the other foods parents are worried about? You know the list, right? We're talking about cow's milk, soy, wheat, tree nuts, in safe forms, of course, sesame, fish, and shellfish. The old advice might have told you to delay all of these too. So let's put the old thinking head-to-head with the new. Delaying these other foods? Turns out there's no proven benefit, and some studies even hint it could cause harm. On the flip side, introducing them around 6 months, there's no known harm and it very well might help prevent allergies, just like we see with peanut and egg. And hey, don't just take my word for it. This is coming straight from the top allergy organizations in the world. This quote from their joint report says it all. There are no data showing harm. It's about as clear as it gets. The official advice now is to not go out of your way to delay any of these common allergens. Okay, so we've covered the what, the why, and the when. Now for the most important part, the how. How do you actually do this at home? Safely and without all the stress. Let's use peanut as our example. Step 1, and this is absolutely crucial for safety, is picking a form that's safe for a baby. No whole nuts, no thick globs of peanut butter. That's a choking hazard. Instead, you can take smooth peanut butter and thin it out with warm water or milk until it's a runny consistency. Step 2, mix a little bit, say about 2 teaspoons, into a food your baby already knows and likes. And step 3 is all about being consistent. You want to offer it regularly, something like 2 or 3 times a week. And that brings us to another huge takeaway from the official guidelines. This is not a one-and-done kind of thing. For that protective effect to really work, for the body to learn to tolerate these foods, they need to become a normal, regular part of your baby's diet. And please, please, do not stress yourself out about measuring the exact number of grams every time. The research is pretty clear that it's the consistency, the regular exposure a few times a week, that matters way more than hitting some perfect dose. The goal here is just to make it a routine, not to be perfect. So what we've seen is a complete shift in thinking, right? Moving away from this culture of fear and avoidance to a new one of early and proactive introduction. This is a massive change in how we approach pediatric health, and it leaves us with this really hopeful question. If we put this new science-backed playbook into the hands of parents everywhere, can we finally turn the tide on the food allergy epidemic for the next generation? The evidence sure seems to suggest that we can. If you're a new parent, you know the advice on introducing solid food